first of all, when we talk about the individual vertebrae, because you'll notice at the bottom, we have fused vertebrae. So we have individual vertebrae, and then we have the fused vertebrae at the bottom. And the fused vertebrae, the big one is called the sacrum, and then the smaller one is called the coccyx. And when we look at our vertebral column, we see that there's a natural curvature to it. So I want you to point out which part is concave and which part is convex when you look at the natural curvature. On my hanging model, you can actually see where the spinal nerves are passing through the intervertebral foramina, and you can also see the intervertebral discs that cushion the places between the vertebrae. But when we talk about our vertebrae, we have individual vertebrae. We have three sets. We have our cervical vertebrae, and a lot of times people say breakfast at 7, lunch at 12, and dinner at 5, because we have 7 cervical vertebrae, we have 12 thoracic vertebrae, and we have 5 lumbar vertebrae. And with the cervical vertebrae, there are 2 exceptions to their general shape. The first one is called atlas, and you'll notice that atlas has some markings to help support the placement of the skull. So that is C1, or our first cervical vertebrae. And C2 is called axis, and axis allows for the rotation of the head, right, turning on an axis. So atlas is C1, and atlas is C2. And they have a structure that is a little bit different from the rest of the cervical vertebrae, C3 through C7. If you look at the cervical vertebrae, there are some features for all the vertebrae, not just the cervical, that I would like you to identify. The first one is the body. So general features that you should be able to identify are the body, the vertebral arch, the vertebral foramen, the transverse process, the spinous process, the superior or inferior articulations, and the intervertebral foramina. And so if you look in your lab manual, there's a page where it has a typical vertebrae and it has all these structures labeled. So when you look at these vertebrae, you should be able to tell some of these general features. Now, to tell the difference between a cervical vertebrae versus a thoracic versus a lumbar, you can kind of look at the spinous process. If it looks like an elephant, like, you know, the trunk of an elephant, then that is a cervical vertebrae. If it looks like the face of a giraffe, then that will be a thoracic vertebrae. And our lumbar, they get very thick, and so we tend to call them moose-like. So they look more like a moose. Okay, so you can use those general descriptions to tell the difference from a cervical versus a thoracic versus a lumbar vertebrae for the individual. Remember, the sacrum is part of the vertebral column, and it is fused vertebrae. And then the coccyx is also part of the vertebral column, and it is fused as well, and it's at the bottom. So I want you to look at your vertebrae and find these general features. You can label them and color them on the